Hello. Wait a minute. Good morning, everybody. My name is Patricia Williams, the Community School Director at is it PS 327, and I'm excited to share with you today Miss Ruth Vega from the American Italian Cancer Foundation, and she's going to share with us some information about breast cancer screenings. As some of you may remember from last November, they actually came out and they screened some of the families in our Brownsville community. So I'm just so thankful to give her the virtual mic at this time so she could share some insight and give us some information on the importance of breast cancer screenings.
Good morning, everyone. Thank you, Ms. Williams. As you said, my name is Ruth Vega. I'm the Director of Cancer Screening, Outreach, and Education at the American Italian Cancer Foundation. And we'll be talking about breast cancer early detection today. And we'll just be going over some important facts, figures, as well as some actions that you could do to ensure that you are staying healthy and doing your annual screenings. I'm going to share my screen at this moment so you could see our PowerPoint so that this can be a little bit more exciting for all. Okay, so here we are. So the American, I just wanted to give you a little bit of an agenda about what we're going to do. So we're going to talk about our organization, talk a little bit about what is breast cancer, how common breast cancer is, and who is at risk for breast cancer. How we can reduce or decrease the risk for breast cancer, signs and symptoms of breast cancer. What is early detection? What do we mean by that? And everyone has heard the catchphrase, what is that early detection saves lives? So what does that mean? And what to expect at a mammogram appointment. Okay, so oops, sorry about that. Just a brief overview about our organization. The American Italian Cancer Foundation is a nonprofit organization. We have two programs at our organization. One is the International Postdoctorate Fellowship Program that started in 1983. And basically what that is that we support about 20 postdoctorate fellows. These are young researchers, medical researchers, who are doing studies on cancer. So it's all types of cancer. They do their fellowship at different cancer centers throughout the United States, and many of them are working on breast cancer. So our hope in investing in these scientists is that they will find new treatments and cures for cancer and hopefully breast cancer. Our other program is the Mobile No-Cost Breast Cancer Screening Program. And that's the program that I work primarily on. And in that program, we offer no-cost mammograms to women 40 years of age and older who have not had a mammogram in 12 months. So we have a bus, which you saw in the first screen. And on that bus, we just do some mammograms at absolutely no cost. So women who have insurance, women who don't have insurance, etc. At this time, because of COVID and social distancing, our program is on pause, so our bus is not going out, but we are still here for folks, and they could contact us. At the end, you'll have a phone number where you could call us, and if you want to do a mammogram or have your annual mammogram, we'll help you to locate a facility that can do it for you and that is safe. Okay, so going on to what is breast cancer. So we talk about breast cancer, we say breast cancer, but what exactly is that? So our bodies are all made up of, oops, this is just acting up right now, I'm sorry. So our bodies are made up of different cells, and cells build up into tissues and then into organs. So each cell is for a particular organ, and our bodies are created so that they're pretty smart, independent of how what we do. And so, as some cells die, others come about, and they replace them in the different organs, and they know exactly what to do in those organs. So, what happens with cancer is that we have an abnormal cell growth. So that means that a cell that is replacing another cell in the breast tissue or in the breast area starts to divide and grow abnormally, so too quickly. And when that happens, sometimes they form what is called a tumor. So it's a cluster of these abnormally growing cells, and then they interfere with the normal functioning of that tissue or organ. Okay? So that is cancer in a nutshell, and breast cancer in particular. So where does breast cancer start? So this is just a model of the breast, the side view and the front view. So this is as if it would be cut, sliced horizontally into the breast. So you could see where the breast, where the cancer would develop. So there's primarily two places that the breast cancer can develop in. So we'll show you right here, and you'll see with the arrows. So it is sometimes in the duct of the nipple where the milk would come in. So it's that long tube that you see right there that's pointed. You could see it better here. It would be that tube right there where the cancer can form, or the abnormal cells could start growing. The other place is in these sacs which make the milk. So these glands that make the milk. That's where it could also grow abnormally. So those are the two places. There are other places that it could also happen, such as the lymph nodes and stuff like that. And that's a smaller number, but when it does grow in those areas that are by or near or kind of connected to, it's no longer called breast cancer. All right, so how common is breast cancer? So, breast cancer is very common. It's the most common cancer among women. It's the most common cancer among women, aside from lung cancer. So lung cancer is actually the most common one, followed by breast cancer, and they kind of toggle back and forth. Roughly 1 in 8 women will develop breast cancer in their lifetime, and in the U.S., cancer is the second leading, like I said, after lung cancer. It is the second leading cause of death in women. And in New York City, on average, about 5,000 women are diagnosed with breast cancer each year. Now, we'll talk a little bit more about what happens with these 5,000 women, but those are the basic statistics, just showing you how common breast cancer is. But with early detection, women are able to survive. So who do you think, I don't know if anyone wants to chime in on who gets breast cancer? Anyone? Like, who is the most is at risk for breast cancer? So
those with family members that already have a previous history.
That's only about 20% of the women who get breast cancer. So, but yeah, I mean, obviously women who have a family history have a higher risk of getting breast cancer. So these are the risk factors. Gender, that means if you are a woman, you are more likely to have breast cancer. So females have a higher chance of getting breast cancer than men. It's just the way it is. Age, another thing that we cannot control. The older we get, the higher our risk for breast cancer. So if you're a woman, the older you are, the greater your chance of getting breast cancer will increase. And then the other factor, and this is for both breast cancer and other cancers, is lifestyle choices. So, what you eat, what you drink, if you smoke, all these are things that contribute to your risk of cancer. Okay? So there's some things that you should look out for. So, what are some of the signs, let's say, of breast cancer? And these are just some things that you may observe, but sometimes you just don't observe anything at all, which is why we are going to talk about mammograms and that important. So sometimes you will see the dimpling of skin. So the skin protracts in, um, and that's a sign. If there's any bleeding or red discharge from the nipple, if there's changes in the nipple in the shape or form, sometimes it also protracts in. Changes in the skin color or texture, so something that doesn't go away, something that's only on the breast. Sometimes you get a rash, sometimes you have sensitivity, you have sensitive skin and it gets a little dry, but it happens in other parts of the body as well. That would not be a sign. But if it's specific to the breast and it doesn't seem to be changing, that's something. Pain, it needs to be new and persistent. So not something that happens and then it goes away, but that it's constant. And then any lumps, bumps, or thickening of the skin. So these are all signs, but again, sometimes there are absolutely no signs. So breast cancer detection. So how do we detect breast cancer? So there's 3 steps to early detection of breast cancer. And one of them is self-awareness, clinical breast exams, and yearly mammograms starting at age 40, or at least having the availability of a mammogram starting at age 40. So we'll look at these individually. Self-awareness, so breast self-awareness. So you have to be aware of your body and know what's normal for you. Everyone is different. So it's important to be in touch with your bodies, know what it looks like, know what's normal for you. And then if you see something that is different or that has changed, it's important to talk to your doctor as soon as you notice it. When we talked about breast cancer, we said that the older that you are, the increased chance of getting breast cancer, but younger women also get it. So it's important before age 40. So it's important to know what's normal for you because everyone is different. And it's also important to have a doctor, someone that you go to see on an annual basis for a checkup. And this is when you can talk to them about what is different. But if you see something that has changed, it's important to call them, to talk to them, and to let them know what the changes are and to go see them. If you're seeing someone on a regular basis, annually, they know you, they know who you are, they know your family history, and they'll be able to guide you in the best way. Okay, clinical breast exams. So these are clinical breast exam. A clinical breast exam is done by a healthcare provider. So a doctor, nurse practitioner will do a clinical breast exam. For women 20 to 39, they should have one every 3 years. So either your GYN that you see on a yearly basis will do it, or your primary care or nurse practitioner. So it doesn't have to be the GYN. Your primary doctor could do it as well. And then women who are 40 and older should have a yearly clinical breast exam by their doctor. So just to talk about now, what is a mammogram? We're saying that women over 40 should have it annually, but what is it exactly? So a mammogram is a screening tool. Right now, it's the best tool we have to detect breast cancer, other than obviously a woman finding some abnormality. And this, even if someone does find an abnormality, usually the mammogram is the first screening tool that a doctor will prescribe. A mammogram is simply an x-ray of breast tissue. So just like other x-rays that are done of other parts of the body, This is an x-ray of the blood of the breast tissue. And as you can see here, these plates, that's where the x-ray is going to happen. The breast tissue will be compressed because it needs to be compressed in order to get an image. It also is sometimes able to detect abnormalities that are too small for you to feel or even notice. When we did our signs and symptoms, you saw that. Okay, so a lot of folks talk about digital mammograms, and so we wanted to just let you know what a digital mammogram was. So there's a difference between an analog and a digital camera. So some of you who are older may have had just cameras that you had film in. So that's what we like to compare it to. It's hard to do that when people are a lot younger and don't remember those cameras. But these were just like one-shot deals. Like you got what you got and that was it. With the digital imaging now that is done of the breast tissue, they could take, first of all, multiple images at once. It doesn't have to be a one-shot deal. And then you're able to, on the image itself, zoom in and zoom out and take a closer look at what's going on there. This decreases the number of times you have to go back. Okay? It goes onto a computer. If you do your imaging or you do your mammogram in one place and then go to a different place, they basically just give you your images on a CD. Okay? And they can be shared because they could be sent electronically. Okay? The benefits of regular breast cancer screening. So one of them is that the cancer can be detected early. So if a woman is starting at age 40 or whatever their doctor recommends, because of family history, you have to talk to your doctor about these things. They might ask you to go earlier or more frequently. So if you're doing your imaging every year, the radiologist or the person who's reading, the doctor that's reading these pictures and analyzing them, they could do comparisons. They could be like, this is what we had last year and this is what we have this year. What are the changes? It looks like there's something different here, but it's here. It was here last year and nothing, and it's not growing, so we're fine. Or there was nothing in this spot last year and now it's here. So this is something that we have to look at even more. So this is why it's important to do this. Okay, again, it can be found, a mammogram can find tumors when they're very small, even before they can be felt by just a touch, okay? And it's been documented that mammograms can find a cancerous tumor up to 2 years before a lump can be felt. So some women have barriers or things that prevent them from having a mammogram. And so we just wanted to go over some of these common barriers. So that one of them is fear. And a lot of women are fearful about what it will find. So what we like to tell them that it's better that you know about it and that you get treatment for it as early as possible when it's going to be easier to treat than if you're diagnosed at a later stage of cancer when the treatment is much, much harder. Another thing is cost. People say they don't have insurance, that their co-pays are too much, that they can't go. So there are programs besides ours that also provides no cost, so you don't have to pay anything out of pocket. They'll take whatever insurance you have. Most insurances now will not charge copays or deductibles for mammograms. And if you don't have insurance, there are a number of programs that also do it at no cost, so absolutely free to the person who's getting it. The other one is that everyone complains that it's painful. You know, some people say painful, some people say uncomfortable. But what we say is that if you're uncomfortable for a few minutes, and basically that's all it is. It's just a few minutes that you would get your breasts compressed. That's very different from them going through full-blown cancer treatment and how much more painful that is, and how much of a toll it does take on a person's body. The other one is lack of time. So a mammogram from start to finish, from when you're doing your paperwork, if you do a clinical breast exam and you do a mammogram, takes about 40 minutes. So I think that you can find 40 minutes in your day. There are appointments that happen on the weekend or during the week, in the morning, in the evening. It's been made readily available, and folks should take advantage of it. Many people, many women actually say that they're taking care of kids, they're taking care of their house, parents, etc. But we say if you don't take these 40 minutes to take care of yourself, you're not going to be healthy enough to take care of others. Okay, early detection saves lives. This is something that we say, and we say it because if cancer is detected early through a mammogram, through a clinical breast exam, through your doctor, the survival rate is 90% plus. Okay, and it's detected at late stages, or late stage 4, when it has maybe spread to other parts of the body. It is 27% survival rate. So that is a huge difference. Also, there is hope. If you have breast cancer, it's not the end of the world. It's not a death sentence. There are millions of survivors in the U.S. Of breast cancer. Okay, so the other thing is, like, how do we decrease our risk for breast cancer? One is having a proper diet. So with breast cancer and other cancers, this is really important. Processed foods have been shown to cause cancer. Eating fresh vegetables, fresh fruit, as much as you can get it. I know it's difficult at this time to do that, but as much as you can get that, it's important, and try to avoid processed foods, junk food, stuff like that. You can have it occasionally, obviously, but a proper diet is going to go a long way to reducing your risk of breast cancer and of cancers in general. The other thing is regular exercise. So a lot of us, especially now, are sitting around a lot. We've been home a lot, but we just have to start moving around. Okay, regular exercise on a daily basis, maybe taking a walk, maybe it's a 15-20 minute walk, increasing it slowly. That is extremely helpful. Doing some kind of exercise. We watch TV a lot, but there's a lot of exercise programs that we could find on YouTube or whatever. You don't have to join a gym. Just move around. It's very important. Limit your alcohol consumption. Alcohol has shown to increase breast cancer in women who do drink more than a glass of alcohol a day. So that's something. And smoking, obviously, is another one that will increase your risk of both breast cancer and lung cancer, which are the 2 leading causes of death in women. So what to expect at a mammogram? So the first step is that you're going to be asked your medical history, and this is important because they will be looking at things closely when they do the mammogram in terms of that. And this is just medical history that you would do at any time. Again, a reminder to see your doctor on a regular basis so that he can instruct you on when to get a mammogram and how often. As a general rule, after age 40, it's once a year. The second step, for some folks, we do this doesn't always happen, is a clinical breast exam. So if you've gone to your doctor, they've done the clinical breast exam, they probably won't do it at a mammography center, but we do it, and we will continue to do that. And then is the mammogram, as we described it, and basically what will happen is that your breast will be compressed into that machine that we showed you earlier, and they'll take a quick picture of it. Your breast is in the compression for less than a minute. Two compressions or 2 pictures are taken of each breast. Okay. So we have just some true and false for you guys. So here's our first one, and just jot them down for yourself, and then we'll reveal the answer. So most women who get breast cancer have a family history of breast cancer. So that is false. Only 20% of the women who get breast cancer have a family history. Getting a mammogram can save your life. We've discussed this. That's true. If it's caught early, it really can. And getting a mammogram, and our other question is it more common in women to get breast cancer than any other cancer? And that's true. It is the most common one that form of cancer that a woman can have. And it is the second leading cause of death in women. Okay? As you get older, you're more likely to get cancer, and that is also true. And women should start getting the mammogram at age 40. And that is also true. It is recommended that you start at age 40. Your doctor may tell you otherwise because of your family history, because of your health. Follow the guidelines, okay? And basically that's it. If anyone has any questions, they're free to ask right now. But if you wanted to ask any questions privately, you could always call us at 877-628-9090. We'll be happy to answer your questions, and we'll also be happy to help you to set up an appointment for a mammogram. So if by any chance you don't have a primary care doctor who can send you for a mammogram, we can find you a program that will go, and we're doing it mostly at standalone facilities right now that can observe social distancing and have safety measures in place to ensure that it is done safely. But one thing that we do have to remember is that regardless of what's going on in COVID, you still should get your annual mammogram. You should not postpone it unless you talk to your doctor and they tell you otherwise. It's important to have it annually. Okay, so any questions?
I have a question.
Sure.
How high is the risk for men compared to women?
The risk in men, I believe, is 1 in 10,000. So there's actually no recommendation for all men to get tested for breast cancer. So if males do find an abnormality, they will sometimes find a lump actually on their breast tissue. It's sometimes easier to just feel. But if there's any of those symptoms or signs that we went over, and men have any of those, they should definitely go to their doctor. The doctor will most likely not recommend a mammogram. They will probably recommend an ultrasound just because of the way the breast tissue is different in men. But yeah, that's it. So it's much less common. That's why there's no regular screening.
Thank you very much.
Anything else?
Anyone else? Well, we're going to offer this to you. Hold on, Ms. Vega.
Well, thank you so much.
Yeah,
I actually have a question. So for women who test in like one of the mobile sites or even at your company site,
Yeah.
let's say they test positive, what would be their follow-up? Will they be referred to a doctor, or would they have to find that out on their own?
No. What happens was when someone, particularly in our bus, but this happens in other places too. So basically, once a woman gets her tests and the tests show some kind of abnormality, the facility where you had your mammogram will contact you. So they will actually call you and say, hey, this is even before you get the written, because everyone gets a written letter. But before you do that, as soon as they see that there's an abnormality, they will contact you. They will call you and be like, hey, we want you to come back in. You need to get additional tests done. And if that is not, if they're not able to contact you after a number of times, they will obviously send a letter, and they will do everything they can to contact you. For our program, anyone who does get that also gets assigned a patient navigator, and so that patient navigator will call them, make sure they know what their results are and what the recommendations are. Some of the recommendations are to go to your doctor and to have them compare the screenings. Others are recommending an ultrasound, etc. So our patient navigator, and there are others in other programs, will help you to set up appointments for the additional testing that is needed to rule out cancer. Sometimes if someone hasn't had a screening in a long time, there's nothing to compare it to. And so you'll have to have an ultrasound. Others, it's their first time, so that's another reason why. But there will be someone at whatever site you get tested that will contact you, and they should help you to get the additional testing or set up those appointments. But if they don't, you could always call us and we'll be happy to help you.
Thank you. And for those who don't have a primary doctor, will they be able to call you guys as well to find one, or, well, to get help in finding a primary doctor? Because I know a lot of women, you know, some of them are scared of getting results, so they're not going to their doctors regularly.
Yeah,
and
said,
they're falling behind.
even if they don't have a doctor and do not go to see a doctor regularly, they should still contact us, and we'll find them somewhere where they could go to get a mammogram. And then if they need follow-up from the mammogram, they'd be able to get it through us as well.
Thank you.
Ms. Vega, could you just put the number in the chat for me, please?
Oh, sure.
And the organization email. Thank you.
The organization does not have a
Not email. I meant
website. Yeah, and you could go to both of those spots and you could get more information, or you could get our phone number and reach us directly. Okay. Anything else? Well, thank you so much for having me. And if anyone comes up to you and they have questions about this, by all means, give them our number. We'll be happy to help them. All right. Thank you so much for having me.
All right.
Absolutely.
Thank you so
Thank you
much.
very much.
You have a great day, Ms. Vega. And thank you, Ms. Lusanne, for popping in.
Take care.
All right. Take care.
Bye-bye.
Bye-bye.